Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Dennis Hursh. He is a healthcare attorney. Today's Kevin MD article is The Legal Trap Every Doctor Needs to Know Before Signing a Contract. Dennis, welcome back to the show.
Oh, thanks. It's good to be here.
So let's jump right into your most recent article. What led you to write in the first place, and then talk about the article itself.
Well, I've been doing this for about 40 years, and from time to time, a physician will call me and say, "Look, you got to look at my contract. I don't see where I can get out of it in less than 3 years." And I've had many instances where they said, "I really like it here, but my spouse's mom is sick, and we want to move back home." It's nothing against these folks, but I just want to move home. And we look at it, and the agreement doesn't have a without cause termination. So for 40 years, I've been saying, don't worry about it. Nobody wants a physician that doesn't want to be here. We give them adequate notice, and everybody always says, okay, fine. Hate to see you go, but I understand. Then I had two in a row where I didn't have a without cause termination. In one case, well, actually, in both cases, they got a better deal. But in one case, it was a really horrible situation. So we did the same thing we always do. We gave him, he wanted to give 90 days notice. I convinced him to give 5 months notice, saying, look, I'm leaving this date. Well, we got a email from the general counsel saying that's a breach of the agreement. Yeah, which is technically true. It was. There was no ability to get out soon. I said, well, we're leaving anyway. So what are you going to do about it? Basically, I'm not quite that confrontational. A few days later, I got an email saying we got to repay the signing bonus. And that was contractually clear. Many times they have amortization of a signing bonus. This one was flat. If you don't do 4 years, then you have to repay the entire signing bonus. So we didn't think much of that. I had warned my client that was coming. Then a couple hours later, I got another email from the general counsel saying, oops, no, that is in error. This is a breach, and we're going to hold you to your agreement. Usually there's some kind of pay us money or something. It was just that. No, it's a breach. We're going to hold you to the agreement. A few days after that, I got a FedEx in the mail, or a FedEx came in, and it was two letters. One was a letter to the physician saying this is a breach and we're holding you to your agreement. Again, no offer to settle. The other was a letter to the general counsel of the hospital he was planning on joining, saying this physician has a contract that doesn't expire till December of 25 or whatever, and you are interfering with our contractual relations if you hire this physician. Now, as I said, I've been doing this for 40 years. The only time I've ever seen that argument before was in a covenant not to compete. Somebody has a covenant, says, I won't compete within 20 miles. They go to work within 20 miles, and the current employer sends a letter like that. I've never had, if you hire my guy. Well, the general counsel at the new hospital just laughed it off. It's like, yeah, recruiting. You're going to sue me for recruiting. Okay, good luck with that. But ultimately, we decided that he's just going to stay. So they have succeeded in getting a physician who doesn't want to be there to stay for almost another year. It's just crazy. Then the next one that came up, literally the very next one that came up, very bad situation. The hospital's breaching. The physician is not getting adequate support. Things like 3 cases, surgical cases scheduled, but they only had 2 sets of instruments sterilized. Traveling staff each time, no physician, just horrible situation. But he went in, got a better deal, talked to the CEO, said, look, I want to leave in about 8 months. The CEO was very understanding. We understand you got to take care of your family. We completely understand. A couple of days later, he got a demand for over $400,000. We think these are our damages. So as long as you pay us $400,000, we're okay with you leaving. Now, you should realize it is reasonable for a hospital to get some damages. I mean, if you come in Friday and say, I'm not coming in Monday, it's going to create chaos. They're going to have to be rescheduling patients. Patients are not going to be happy. They're probably going to have to hire a locum tenens, and all of that costs money. So I'm not arguing that you should be able to just walk off the job. But with that much notice, they should be able to reschedule and rehire, frankly, in 5 months. And this hospital where the physician is breaching has been recruiting, but it's obvious to me if you recruit for 6 or 7 months and you're not getting anybody, maybe I'm just a genius, but I think that you're probably not paying enough.
Hmm.
Uh, I mean, that seems really obvious to me. We've been trying to get this surgeon. We're offering minimum wage. We've been trying for a year, and for some reason we can't get anybody. Well, clearly you're not offering enough. But this hospital is digging in, and literally they came back and said, we thought it was magnanimous to offer 400,000, but we're willing to give, and it's precise number, like $147,216.12 or something. So I asked, where did that number come from? He refuses to say that's the number. So once again, I mean, this physician probably is going to end up paying something to get out, but it's crazy to me that you would want a physician who doesn't
Hmm.
want to be there. And apparently that's the case now.
And to be clear, these are cases where a physician initially agreed to practice in that current job for X number of years, 3, 4 number of years, and then they want to get out within that initial commitment.
Correct, correct. And so, I mean, whenever I review a contract, that's always one thing I always try to get in is a without cause termination because things do happen. As I said, you may be just loving it here. It may be the best place to work. It's absolutely perfect for you. You love the climate, but your mom gets really sick. You may want to go home. It doesn't matter how happy you are here, or your spouse mom gets sick. I mean, there's just a lot of reasons that you may want to leave that position. So it's really important that you have that option to do so without being threatened with a breach of contract.
So when you say earlier that a physician can leave without cause, this for those who aren't familiar with that terminology, just briefly explain that.
Well, any contract always says if you lose your medical license, you lose medical staff privileges, whatever, we can terminate you. And that's for cause. You did something wrong. For that reason, we feel you're breaching. But the contract should also have a clause that lets you leave, just give some reasonable notice and leave for no reason. It's not, hey, the hospital's breaching, you're doing horrible things. Just I have my reasons and I want to leave in 90 days or 120 days. Every contract should have that, no matter how devoted you are to the employer. As I said, things come up and you may want to leave.
So what are you advising physicians to do? Because I assume that this scenario can come up more frequently going forward because every physician commits to a certain practice or job for X amount of years up front.
Yeah, yeah, I think it's just critical that you get a without cause termination. And I know this one employer that has been so obnoxious just refuses to put it
Hmm.
in. Honestly, my advice is if they're not willing to do a without cause termination, to keep looking because that's scary to me. If I'm so unsure about how our relationship is going to unfold that I don't want to give you the ability to leave under any circumstances for 3 years, you got to wonder, how pleasant are the working environment is the working environment going to be?
So just to be clear, let's go back to that scenario where a physician wanted to move out of state and that employer refused to let him do it and sent you that FedEx notice to that effect. What are the repercussions of that physician if they just left anyway?
Well, I think they could come after him for damages. And the damages would be basically we tried to recruit, but while you were gone, we couldn't recruit. So we had to hire a locum tenens. And the damages should be the difference between what we paid the locum tenens agency and what we would have paid you. And a lot of physicians, I tell them that, and they say, oh, I'm not too worried about that. Locum tenens don't make that much money. And they don't, but the locum tenens agencies really do make a lot of money. So it's expensive to replace a physician.
And you mentioned that you had two of these cases back to back, but are they really outliers, or is this something that you're anticipating to be part of a broader trend?
I think it must be a trend. Again, two could be an outlier, but I've been doing it for 40 years and never have had this come up. And now two in a row. I think that the physician shortage is getting so bad that I don't care if you like it here or not, I want you here. And in some senses, physicians, you can always give them the short end of the stick. You do that to the janitor and he's not going to clean well. He's going to come in late. He's not going to do all his duties. Physicians, they're going to keep doing 100%. They're going to do everything they can for their patients. So if I'm an administrator, I guess I say, what's the downside here? So an unhappy physician, so what? They'll keep killing themselves for the institute. It's not really for the institution, it's for their patients, but it works out for the institution.
So now that you're advising physicians to make sure that they have a without cause termination clause in a contract, so in general, are you successful in getting employers to put that in if they don't have it in the first place?
I usually have been over the years, yeah. And I do think I suspect it's an issue with the physician shortage that they just say, nope, no matter what, we want this physician here, no matter what. But yes, you generally can, particularly if a physician comes in and makes it clear, I may not join this place without
Mhm.
cause. I mean, you do a list of things that you'd like, they'll give you some they won't. But if you really stand pat on that, most places will put it in.
So it sounds most places are relatively reasonable, but it's really the most draconian places that would just simply refuse and potentially trap that physician there.
That's my position, but the one draconian place is a major national institution. It's not like the other one is a small hospital in a rural area, but the other one is a huge institution, employs thousands of physicians. So it really is a big deal if they just decide, you signed up you got a 3-year sentence and that's what you're going to serve.
So going forward, are there any other red flags similar to what you're talking about that physicians have to look out for, or something that you may see that's on the horizon?
No, I think this is the biggest one. It's all the general stuff, make sure that they're paying for tail coverage and all the other things that you always have, make sure they're paying you fairly. But even if this seems like the dream job, you should still have a way out.
We're talking to Dennis Hursh. He's a healthcare attorney. Today's KevinMD article is The Legal Trap Every Doctor Needs to Know Before Signing a Contract. Dennis, as always, let's end with our take-home messages to the KevinMD audience.
Again, read your contract. I'm a little biased because I review physician employment agreements, but I really think you should have an attorney review it so you can find out what the implications of what is in the agreement, and sometimes more importantly, what isn't in the agreement. Because if you may not, if there's no mention of without cause, a physician may not even think of it. Just say, I looked at everything that was in there seemed okay. But it pays to have your employment agreement reviewed, I believe.
Dennis, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
No, it was a pleasure. Thank you.